seguir
the
haciendo.
schools
Esta ya es
because
la quinta
obviously the
edición.
schools are going to continue.
Em,
This is already the fifth
lo otro
edition.
también en términos de
The other
participación,
element in terms of
queremos que nos
participation, we
ayuden a
would
hacer que
like
este
to
mensaje o estos
uh,
mensajes
you
lleguen
to
a
help us so
públicos
that the
que están
messages
por
can
fuera
get
del
to
evento. Somos más de
populations that
3.000
are
personas,
outside
pero
here.
qué rico
For more
que
than
con la ayuda de
3,000
todos
people, but
ustedes
wouldn't it be
usando
wonderful
sus
if with your help,
plataformas,
using
sus
your
cuentas en las redes
platforms,
sociales,
using your
nos
accounts and
ayuden a
social
llegar a más
networks
personas
will
que
help
pueden
us to
colaborar con
reach
la salud de
more
los
people
migrantes y
that can
refugiados,
collaborate with the
poniendo
help of migrants
sus
and
propias
refugees
ideas,
by placing
de
their own
pronto parafraseando
ideas,
a los
perhaps by
speakers, compartiendo
paraphrasing the
algunas
speakers,
fotos, todo eso va a ser
coloring
muy
some
importante.
images. All
Ahorita les voy
this
a
is
decir
going
cuál
to
es
be
el
very
numeral que
important. I'm
debemos
going to tell
usar para
you
que realmente el
what
algoritmo
is
nos
a,
oiga y
a
entonces
hashtag that we
nos
have to
ayude a que
use
esta
so that we
conversación se
can be
vuelva
heard by
realmente
the
grande a
algorithm
nivel global.
and so that the
Y
mechanism
el
can be
último
large on a
anuncio es,
global
pues
level.
como
The
ya
last
nos dijo
announcement
Candelaria,
is,
este
as
evento va a ser
Candelaria
originado
already
en
said,
inglés,
this
pero
event
en la
is going to be
plataforma
in English,
tenemos los dos
and the
idiomas, entonces
platform
ustedes
is
pueden a
the
través
two
de sus
languages.
equipos de
So
traducción
you can hear
escoger el
through
idioma
the
que
translation
que quieren
equipment to
escuchar,
choose
en
the language,
inglés o en
and you
español.
can hear it, okay,
Obviamente les van a pedir
Spanish
un
or
documento
English.
para tener su equipo de
Obviously, a
traducción,
document is
pero
going
se
to
los
be
van a
asked to
devolver cuando
have
ustedes
your
devuelvan su equipo de
translation
traducción.
equipment, but when
Entonces, ya con eso
you return
estamos
the
listos
equipment, you will
para
have your ID
inmediatamente,
back.
cuando llegue
So
el
with this,
ministro,
we're
poder hacer
already,
la inauguración
when the
de
minister
esta
comes,
escuela
we
y
can
ahí a
have the
partir de ese momento
inauguration
ya
for
les
the school, and from
hablaré en
now, from that
inglés
moment, I'll
únicamente.
speak to
Muchas
you
gracias.
only in English. So thank you so very much.
Las personas que están afuera, por
Those
favor, si pueden
individuals that are
ingresar para poder
outside, please,
empezar
if you can come
puntualmente. Agradecemos mucho porque como este evento va a ser grabado y transmitido, como saben, a
as you well
143
know, to
países y más,
143 countries or
nos
more.
está esperando mucha gente y queremos ser
We
puntuales con
a
ellos.
lot of people are waiting us, and we want to be punctual with them. Uno, dos, uno, dos. Canal inglés, este es el canal inglés. Uno, dos, esto es el canal inglés.
Recording in progress.
Bueno, estamos por comenzar. Les agradecemos su paciencia, que vayan tomando sus asientos. Estamos tratando de hacer
We
unos
are about to begin.
ajustes
We
en
thank you
nuestro
for your
canal de
patience. We are
transmisión de
attempting to
YouTube
have
para
some
que las personas que
adjustment
nos
for
están
our YouTube
acompañando
transmission,
virtualmente puedan tener
so
la
that those that are
traducción
with us
en los dos
virtually
idiomas,
are able to have interpretation
que es
for both of
español
us
e
in both
inglés.
languages, which is
Y bueno,
Spanish
también
and
estamos
English.
esperando, el ministro de
We
Salud
are
está
also
ya acá,
waiting for the
pero
Ministry of
está
Health.
con
He
mis
is also
colegas
here,
periodistas
but
que
he's
tienen
with
muchas
our
preguntas
colleagues.
para él, entonces estamos
Privilege
esperando
them have a lot
también
of
que
questions,
termine de
so we're
atender a los
also
periodistas para
waiting
que llegue a este salón y
to
podamos
have
comenzar. Muchísimas gracias por su
everyone sit
paciencia,
down
por
and
su
to be able to
persistencia.
begin. Thank you very much for your patience and your attendance. 1, 2, 1, 2. As I was going up the stairs, I met a man that wasn't there. He wasn't there again today. I really wish he'd stay away. The reason for the pelican is difficult to see. His beak is clearly larger than there is a need to be. It's not to build a boat with. He doesn't own a boat. It's not a scoop for eating soup. It's not an expression. Please take your seats. We are about to begin. That's terrible.
Hola, sí. Hola, hola. Hola, sí.
1, 2, 1, 2. As I was going up the stairs, I met a man who wasn't there. He wasn't there again today. Everybody should stay away. The reason for the pelican is difficult to see. His beak is clearly larger than there's a need to be. It's not to own a boat with. He doesn't own a boat. Yet everywhere he takes himself, he has that beak to tote. It isn't quite for anything, and yet you realize it's quite a splendid beak and quite a splendid size. The reason for the pelican is difficult to see. His beak is clearly larger than there's a need to be. It's not to build a boat with. He doesn't own a boat. Yet everywhere he takes himself, he has that beak to tote. It's not to keep his wife in. His wife has got one too. It's not a scoop for eating soup. It's not an extra soup. It isn't quite for anything, and yet you realize it's quite a splendid beak and quite a splendid size. Half of our farmers to bring food to the table, Colombians and babies around the world. We are proud of our big mountain ranges, but even more proud of our cyclists who conquer them on the world's longest mountain climb. Here, the wind sounds like progress. And at this time when that speaks with 1900 species of birds and tells them which tree they must reach to be seen. From our oceans come our beautiful islands, and from our islands comes the union of two people. Look at our mountains and look at the hectares left in cultivation. Look at our mountains. And speaking of green, breathe. We eat because we are the lungs of the world. We live in the midst of beauty that changes on a daily basis, where the past, the present, and the future live in each region. Generous beauty for everyone who wants to see it. Those that come for business pay for pleasure, and those that come for pleasure find their business. So here's the invitation. Talk for the first time or return from wherever you are and travel the country. You can keep discovering Colombia, the country of Colombia, the country of beauty.
Hello, everybody. Thank you for being here. On behalf of the World Health Organization, welcome to the fifth edition of the World Health Organization Global School on Migrant and Refugee Health. The video we just watched is a video that shows the beauty of the country where we are originating this edition of the school, Colombia. We are so happy to be the host of this event. I know this is very important, and so we hope with this taste, all of you who are attending online are now eager to come to Colombia to visit us and to enjoy our beauty, our landscapes, our people, our culture, and our music. So welcome when you want to come. Um, Let me tell you something that it's very exciting for us. You have given an amazing response to our call. We are right now in this room more than 100 people, but virtually attending around 3,000 people from 143 countries, 143 countries. It shows us how committed you are to get new tools to improve the way you work for migrants and refugees across the world. So thank you for this amazing response. It shows us also that many of you had to wake up earlier or stay later in order to address the time zone of the event. So we value that very much. Let me tell you about myself shortly, because we are going to share 5 days together, so it is good if you know who I am. My name is Claudia Palacios. I'm a journalist. I'm also magister on gender. And this event is very important for me because the subjects we are going to develop during these 5 days have been crucial during my career. Almost 30 years ago, I started as a journalist covering health issues, and I am still doing that pretty often, as the Minister of Health know very well. And my first book is about migration, stories of migrants from South American countries to the United States. So I am on the same page with all of you in terms of the awareness about the importance for migrants and refugees to have access to health. So thank you to the World Health Organization for inviting me to be your masters of ceremonies during these days. And this is a responsibility and an honor for me. Thank you very much, Dr. Santino, for inviting me, Candelaria for having me here. Said that, this edition of the school will focus on going from evidence to action. Why? Because there are 120 million people across the world who are in need of help because they are refugees or they are migrants, and they are in very tough conditions. They have to forcibly leave their places, their homes. So it is very important to go from evidence to actions. We have a very comprehensive agenda. Every day we are going to have cases from different countries. We will have main speakers every day, and we will have a roundtable discussion. And it is very important for us that you participate during those discussions. Actually, I have some announcements about that. The first is about participation. Many of you already sent questions because we asked you to do that. We are trying to organize that questions, to categorize that, to be able to answer as many as possible during the roundtable discussions. And it doesn't mean you cannot keep sending questions. For those who are virtually attending, please use the the box on the platform to write your questions. And for those who are here, if you want to participate, raise your hand and someone from the staff will give you a mic for you to ask. There is another way to participate, which is very important. This is using your social media accounts. Because even if you have just a couple of followers, believe me, as a journalist, I can say, if you post something using the hashtag we have created for the event, which is migrants, let me tell you, in English, health Migration, and in Spanish, Salud Migración. If you post in your social media accounts whatever you want, pictures, your own thoughts, quoting our speakers, whatever you want, using that hashtag, we can make this conversation bigger and we can raise the awareness of these subjects across the world. So I encourage you to do it, at least one publication per day, because we will see at the end of the event how important it is to reach our goals. And the next announcement is certification. We have your email addresses because you registered, and that way you are going to receive the the certificate of participation. But we need a requirement, which is at the end of each day, you should fill the form we are going to share. On the screens here on the room, we are going to share a QR code. I'm going to remember you to scan it and to fill the form. And for those who are attending online, you can download the file that we are going to share with that form. Even though this is a school, that part is not an evaluation or an exam. It's just the way we create it to get your feedback from the school, because for us it's very important that you let us know what do you like, what you don't like, in order to keep improving for the next editions. So please do that immediately after the end of each session. If you leave it for the next day, we are not going to be able to see that you did it. So please don't miss it, because otherwise you are not going to have the certification, and this is very important. And the third announcement is this event is originating in English, but you could choose to listen it in Spanish using your translation equipment. I know many of you already have them. And for those who are attending online, just click the world icon to choose the language of your preference. Saying that, I think we're ready to open our event. So I want to invite the mastermind behind this important school. And please join me, welcome me, my co-facilitator, Dr. Santino Severoni, director. Wait a second. Ready? Please join me in welcoming my co-facilitator, Dr. Santino Severoni, Director of the Health and Migration Department at World Health Organization. Dr. Santino, it's an honor to share this stage with you.
Thank you, Claudia, for your kind introduction. I'm not a masterminded. I'm just a service provider. I'm supporting my team, and the team made all this possible. So really, thank you very much to everybody contributed to the school. I'm overwhelmed to be here in Colombia, and once more, thank you to the Colombian government in the person of the Ministry of Health for hosting us. It's really a privilege, but also an emotion. Not only because what you have seen in the video is absolutely true, it's a beautiful country, but also I can tell you with beautiful people where hospitality is really overwhelming. And I suspect that this is also partially behind the political vision of promoting universal coverage and inclusion, and pay attention to the importance of right to health for everybody. We came to Colombia because the process of expanding access to health sector for refugees and migrants is often challenged. Challenged because the political sensitiveness around this topic, challenged by the often misuse of the evidence informations for political purpose with an intention to play polarized games, and migration, refugees, displaced, they stay in between that, and they are suffering challenges in accessing health sectors. However, we are observing a world, a number of countries, a large number of countries around the world, which are driving a change. The approach to inclusion, promotion of universal coverage is more and more understood and felt important as an element for managing migration and displacement worldwide. As I mentioned several times, we are accounting about 1/3 of the countries around the world having this approach. And we came to Colombia because Colombia is one of the pathfinder, is one of the countries which really start to tune and play with the element of health systems in order to reply to a commitment of including millions of people in accessing health services. When the issue of universal coverage is posed, usually there are a lot of important questions put on the table. First of all, the economic argument. So who's going to pay for this additional service provided? Second, the social and cultural conflicts, sometimes hiding behind perception of people, countries especially receiving large influx of refugees and migrants or displaced population. But what is important technically, promoting universal coverage requires, as a first step, a political decision. The health system, health service we have is the result of a political choice. And in this case, political choice has to be supported by sound policy, supported by strong evidence and data, has to be supported by a competent healthcare workforce and capable healthcare workforce, and then supposed to be manifesting with availability of cost-effective and meaningful service on the ground. So as you see, it's a very complex cascade of steps necessary to expand the access migrants or refugees to access health services and systems. During this school, we wanted to focus on these elements. That's why we came to Colombia, but also we're going to look to other reality around the world because, as I said, there are many countries moving in this direction. So we're going to have 5 days in our traditional approach. Each day we're going to touch on a sub-argument overarch within the universal coverage and translation of policy into action. This is very important for us. We want to underline that policies need to be supported by strong evidence, which is not always the case in case of health and migration due to the political relevance. So today we're going to focus on primary health care, and we will have a number of interventions from high level and expert. And more important, we want to offer also to the audience the possibility to exchange views and pose questions. You've been hearing from Claudia, we have more than 3,000 people connected today or registered to the school. Let's see how many will manage to connect. And tomorrow we're going to focus on access to chronic diseases. So all the issue of continuity of care, preventive services, and if we need to analyze what is really the emergency or the important spending usually in the health sector, is related to chronic diseases, not related to emergency or related to communicable disease. So this is an important element we want to put forward. We're going to have then on Wednesday a very special day, focus on health financing. Really, we want to enter into the secret room, into exploring the mechanic behind the health financing mechanism, which is the main enabler for expanding the health access to a larger population. What we are talking is not something magic, but it's very high tech, it's very high professional drive and guided. There are very concrete steps. So we want to analyze what is the experience in Colombia and other countries around the world. Then we're going to have a day dedicated Thursday to strong evidence. As I say, it's not rare to see policies related to health and migration, which are more supported, stimulated by a political feeling rather than strong evidence. So we want to walk the talk. We want to really encourage to look into strong evidence, strong data to support the policy formulation process and implementation of this policy at country level. We're going to conclude with a very important element, because also Colombia has a reality of promoting universal coverage, but also emergency context that need to deal. So usually we never have in a country a pure situation. Usually we are having different reality, different challenges coming at the same time. So we wanted to devote a day to the what we call technically the nexus, the interaction between the emergency context and then access to long-term service provision for refugees and migrant population. I'm stopping here in the interest of time. I don't want to steal more with the introduction to the next speaker, which perhaps is my boss, the DG, Dr. Tedros. So I'm very much pleased to launch the video of Dr. Tedros, who is really looking with attention to the big movement generated by this activity, by the Global School. Please, if the video can be run. Thank you so much.
Honorable Minister Guillermo Alfonso Aranilo, dear colleagues and friends, buenos dias. I'm honored to welcome you to the 5th Global School on Refugee and Migrant Health. I thank Colombia's Minister of Health and Social Protection for being our gracious hosts. This global school shows the growing recognition of our shared responsibility to safeguard the health of people on the move.
Much, Dr. Tedros, for the support and the commitment on this topic. Just to share with you, the issue of health and migration and refugees' health is so important and strongly felt into the WHO that the next general program of work, what we call GPW 14, means the Global Health Strategy for WHO, as for the first time next year, health and migration as one of the priority for action with a concrete outcome, output, and indicators to measure also progress. So this is just to confirm the message of Dr. Tedros and the concrete commitments. And now with a great pleasure and very happy to invite Mr. Minister to share and to open the school and to share a few thoughts about his work, the work in Colombia, and the collaboration around the school. Dr. Guillermo Jaramillo, please, the floor is yours.
Since you didn't take much time, I will take a bit of time from you, okay? Muy buenos días a todas y todos. Muy complacido de poder estar acá. Creo que
For everyone, for everyone,
este es un evento de suma importancia,
an
de
extremely
la cual
important
todos podemos aprender
of which we can all learn
y
and
del cual
of which
Colombia está aprendiendo.
Colombia is learning.
Y por eso muy importante
Therefore,
tener la
very
posibilidad de
important
haber
to
escuchado
have the possibility of
al
having
director general,
heard the general
al doctor
director,
Tedros, estar aquí con el
Dr.
doctor
Pedros,
Santino,
and to be
estar
here
también
with
con
Dr. Santino. We are also here
y por supuesto con
with
quien
people,
todos los días
obviously with
en muchas partes del país me encuentro, que es la doctora
whom
Gina,
I
y
find
con
in
todos
several
ustedes que
parts
hemos
of the
venido
country, which is
trabajando.
Dr. Gina, and with all of
Yo
you
quiero
that we've been
presentar algunas
working.
cosas que me
I'd like to
parecen muy
introduce
adecuadas
certain
y que
elements that
están
I believe that are
en la
quite
tónica
adequate
que
and
el
that
doctor
are
Severino nos
in the
mencionó.
topic that Dr.
4 puntos que me
Severino
parecen
mentioned.
fundamentales e
4 points that I
importantes.
believe that are
Y quiero
fundamental
tomarlas,
and
las que dijo el doctor
significant, and I'd
Severino y
like
que
to
hizo
take
el
them, the
Ciro,
ones that
doctor
Dr.
Ciro
Severino mentioned and the one that Dr.
Primary
Ciro
care,
mentioned.
atención primaria,
Primary care,
enfermedades crónicas,
chronic disease,
el tema financiero,
financial
investigación con mucha
aspects,
evidencia, con muy
with a
fuerte
lot of
evidencia,
evidence, with
emergencia
strong evidence,
and long-term approaches.
emergencies and
¿No es
long-term
cierto?
approach.
Y los puntos que
And
mencionó
the
el doctor
points
Ciro
that
tienen
were
que ver con
mentioned
mejorar
by
el
Dr.
acceso,
Tito will have to do with
la
improving
vigilancia de la
access,
salud,
to
reducir la
have vigilance
xenofobia y
in
la
healthcare, to
discriminación.
reduce
Y una cosa
xenophobia and
importante, no es
discrimination, and
posible
something
dejarlo solo.
important, it
Vean,
would not
no es
be
posible
possible
hacerlo
to
solo.
leave you alone. It's
Eso
not
es algo
possible to
que
do this
esto
alone.
me parece
It's
de vital
something, and I
importancia,
believe that this is of
porque
vital
entonces
importance.
reclama lo que nosotros tenemos que
Otherwise,
hacer
you explain what
y
we need
algo
to
que
do, and
terminó
something that
Don't
ended
leave
up
nobody behind, que dijo el
with
doctor Pedro. No dejar
nobody
a
left
nadie atrás,
behind that Dr. Sabrina
¿cierto?
mentioned.
Porque esos
Nobody
son, y
left
tiene que
behind.
ser algo que
Because this
yo
has to be
enmarco acá
something
y
that
que voy a
I
recalcar porque fueron
explain
las
here, and
palabras,
again, I'm
las
going to
palabras
highlight this with
que tienen que ver
this
con los
in
derechos
the
humanos,
words that have to
¿cierto?
do with human rights,
Entonces aquí
right?
Alexandra para que
So
se
here,
prepare aquí porque nos
Alexander,
vuelve a
so that
uno
this small
un inhabilitado.
graphic
Entonces,
that turns out
entonces yo quiero
into a
presentar algo
handicap
que
person,
nosotros tenemos.
I'd like
Voy a
to
regresar
present something that we have. I'm going to
y
return
es
to
el
these
contexto de migración
points,
en
the
Colombia.
context of
¿Cierto? El
migration in
contexto de la
Colombia.
migración
Number
en
one, the
Colombia,
context of migration in Colombia.
no sé hacia dónde dispara uno acá para que se mueva esto. Bueno, el contexto de migración en Colombia,
The context of migration in Colombia.
miren ustedes,
You can see here,
esto es lo que hemos tenido.
this is what we've
Lógico,
had.
para nosotros se nos olvida la
Obviously,
migración
for us,
interna,
we
pero está.
forget the internal
De las
migration that
últimas
we
3
have.
décadas,
In
no
these 3
contamos desde los años
decades, we
50.
did not count since
Yo
from
nací
the
en
50s.
1950
I was born
y a
in
los 2 años nos
1950,
tocó que
and
irnos
2
del
years
sitio
later,
donde
we
yo
had
vivía
to leave where I
por la
lived
violencia de los años
due to
50
the
entre liberales y
violence of the
conservadores.
50s between liberals
Hubo
and
aquí
conservatives.
lo que pueden denominar en otro
What you
país una
can
guerra civil.
name here in
Nosotros
another
llamamos
country
la
a civil
violencia para
war, we
tratar
call it
como de
violence, to speak
aquí
about that
matarnos,
era.
para no decir que nos matamos
It's
entre
not
unos
to
y
say
otros
that we
por
killed
un trapo
each other
rojo y un trapo azul, entre liberales y
just
conservadores.
between reds and
A los
blues.
2
That
años
was the
siendo
struggle.
yo terminé de
When
un
I was
pueblo que
2
era
years
Líbano,
old
en la
from a
cordillera
town
central.
that's called
Aquí
Líbano
cerca en
in
lo que se
the
llamaba
central mountain range,
o se llamaba
here to a
Mesitas del
place
Colegio,
that
que
was
ahora
called
ya
Mesitas del
no es el
Colegio,
colegio.
which now is called
Ahí
El
pasé
Colegio.
por lo menos un año de mi
There
vida
I spent at
porque
least
habíamos
1
sido
year of my life
expulsados de
because
nuestro
we had
territorio.
been thrown out
Como
of our territory.
teníamos una posición diferente, mi señor padre era
Since we
médico,
had a different
aprovechó el tiempo para irse
position, my father was a physician,
para
so we
la
took advantage
Argentina.
of,
O sea, hemos sufrido las
that fact so that
consecuencias.
we could go to
Tuve
our
que irme, doctor, y
I
voy a,
suffered
doctor
the
Santino, quiero
consequences. We
decirle
had
una
to leave.
cosa a usted.
Dr. Santino, I'd
Yo
like to say
terminé
something to
estando
you.
7 años y medio en Suecia,
I ended up
en donde me
being
especialicé en
7
cirugía
years and a
cardíaca
half in
pediátrica.
Switzerland where I was
¿Sabe por
specialized
qué?
in pediatric
Porque me iban a
cardiac
matar
health.
en
You know
Colombia.
why? Because in
Por haber
Colombia I
hecho,
was going
yo
to be
salí electo
murdered
senador de la República en
because I was a
1986 en una
senator in
coalición entre
1986 with a
liberales,
coalition
Partido
between
Comunista,
liberals,
la
the
Unión
Communist
Patriótica
Party, the Unión
y otros sectores
Patriótica, and
progresistas.
others,
Y todos los que
progressives.
hicimos coaliciones con la
And
Unión
all
Patriótica,
those
con
that
el
had
Partido Comunista,
coalitions
fuimos
with
amenazados
Unión
de muerte.
Patriótica and the Communist Party
5.000
were
personas,
threatened in our lives.
dirigentes políticos fueron
5,000
asesinados en nuestro
people,
país. 4
5,000 political
candidatos
leaders were
presidenciales fueron
murdered in this
asesinados
country.
durante esa
4
época,
presidential
entre el
candidates
año
were assassinated during that
1980,
time between
1986 y 1990.
1986 and
Inclusive,
1990.
el
Even
candidato que iba a ser presidente de
the
la República.
candidate that
Se
was
nos
going to
olvida
be
eso,
the president, we forget
¿cierto?
that.
Entonces, esto no
So,
es nuevo para los colombianos. Lo
it's
que
not
es nuevo
new
para los
for
colombianos es
Colombians.
que
It might be what is new for
nosotros salimos
Colombians
para
is
otras
that
partes, para Estados
we
Unidos, 5
left
millones de
for other
Venezuela,
parts for the
Y
United States
lo que
when
era
we
nuevo para
went to
nosotros es
Venezuela.
que
What was new for
íbamos
us
a
was
Venezuela
that
porque
we were
era
going to
un
go to
país
Venezuela
rico que
because
nos
it
daba
was a rich
oportunidades,
country that offered
trabajo,
opportunities, that
etcétera.
offered employment,
Se creó la
etc.,
economía de Venezuela,
etc.
entonces
And when
aparecieron
the economy in Venezuela
los hermanos
failed,
venezolanos acá. Hoy hay
then
3
our
millones
brother Venezuelans arrived. Today
en
we have 3
Colombia. ¿Cómo
million
vamos a atender
Venezuelans
esa
in Colombia.
situación?
So how are
¿Cómo
we
hacemos
going
para
into this
incluirlos?
situation? How can
¿Cierto?
we
Y
include
por
them?
supuesto tenemos la
Obviously,
situación de
that
la
we have
financiación.
the
¿Cómo hacemos esta
situation of
financiación?
financing.
Tenemos
How can we
el
have this
régimen contributivo
financing?
y
We
subsidiado,
have the
por el que
contributive
nosotros
regimen, the
apoyamos a todos y cada
subsidized
uno de los
regimen,
ciudadanos
in which
colombianos.
for
Viene una
each one of
población que
Colombia's
está
citizens, we have a
no
population
asegurada, ¿no es cierto?
that is not
Y
insured,
viene una garantía de
and we
atención para
have
la población
a
migrante. ¿A
guarantee
través
of
de qué? A través de lo
treating
que
the
llaman
migrant population
PPP y lo
through
que es
what we call
PDC.
PPP and
Entonces, aquí
PDC.
están
So
de los 3
we
millones
have
en este
of
momento
the 3
tenemos
million at this
dentro del
moment
sistema de
that
seguridad
we have
social,
within
en
the
salud,
social
tenemos
security system in healthcare, we
1.539.000,
have 1,539,000,
de los cuales el 20% es del
of
régimen
which
contributivo. O sea,
20% is
contribuyen
of
en
the
parte porque
contributive
los
regimen. They
contributivos
pay
no
in part
aportamos, sino la
because
mitad
those that
del
contribute
equivalente.
pay half
El
of
régimen
what
contributivo
they
aporta 19 billones de pesos
the
y
contributive
retiene
regimen
más de cerca de
contributes in $19
45
billion,
millones de pesos a atender
and it's
al
worth more than
contributivo. O
$45
sea
billion
que
to
aquí hay que
attend
despejar
to
varias
them.
dudas. Aquí
So
se nos
here
dice,
we have
es
to
que yo estoy
clarify
pagando por mi
several
salud.
matters. Here we say
Ninguno de
that
los que
pay
contribuimos
for
y
my
pagamos
health,
de nuestro
none of
salario,
those that
estamos
pay from
pagando
our salaries and
el
contribute,
total de
none of
la
us
salud.
are paying the
Si nos tocara
entirety
que
of the
pagarla,
healthcare.
tendríamos que
If we
pagarla
had to pay
más,
the
todavía más.
entirety, we would have to pay even more.
Pasa es que el Estado está
But what happens
contribuyendo
is that the
26
government is contributing
cerca de
to
25
this
billones.
closely to
Especialmente porque
25
las empresas no
uh,
pagan ya a
trillion,
los trabajadores. El Estado el
specifically
que paga a los
because
trabajadores. Cosa
uh,
absurda. Pero
companies
así
are
es.
not paying
Eso
workers.
es lo
It's
que
the
tenemos ahora.
government that's
Entonces,
paying the
el
workers. That's what we
20% es
currently have.
contributivo y el
So
80% es
20% is
subsidiado.
under
Ese es
contribution
un
and
esfuerzo
80%
general de todos y cada uno de los
subsidized.
colombianos
This is the
para
general
una
effort of each one
fuerza
of
de
the
trabajo
Colombians
muy
for
importante
a
que
workforce that is
tenemos,
very
en
important that
donde,
we have,
vean ustedes, el
where you can
55%
see here
son
that
mujeres y el 80%
55% are women
son
and
hombres.
80% are
Y la
men.
mayoría de ellos, aquí
Most
no
of
tenemos
them,
la edad, pero la mayoría de
here
ellos
we
son
do not
jóvenes.
have the data,
O sea,
but
es una
most of them are
población
young.
en
So it's
capacidad de
a
generar una
population that
importantísima
can
posibilidad de
generate
trabajo
a very
como ya lo está
significant
demostrando
possibility of
para
employment,
un país que
as is
desafortunadamente
being
no
demonstrated for a
creció al
country
ritmo que
that
nosotros
unfortunately did
esperábamos.
not grow
¿De
at the
dónde
rhythm
vienen
that
estos
we
recursos? En
expected.
primera instancia, aquí
Where do
están
these
recursos que
resources
tienen
come
que ver
from?
muy
First of all, we have
especialmente con la
resources
atención de
that have to do
urgencias.
specifically with
Todos los
emergency.
hospitales públicos tienen la
All
orden de
public
atender
hospitals
a
have the
cada
order
una de las
of
personas que
tending
lleguen
to
a sus,
every single
a sus
individual that might
urgencias,
arrive
sin
to the
ningún tipo de
emergency
escándalo.
room
Eso
without
vale
any type of
recursos que
stigma.
hemos venido pagando y en este
Resources
momento
that we have
todavía
been paying, and at
debemos
this
algunos
time we
recursos.
still
Por
owe some
supuesto, ahí
resources.
está usted
Obviously,
entonces lo
there
que ha sido
you
facturado,
are,
lo
what
que
has been
definitivamente
invoiced,
se
what
reconoció
most
como pago
definitely
y lo
has
que
been
se ha pagado
acknowledged
hasta
in
ahora.
payment, and what has been
Tenemos
paid up to
todavía
now.
un remanente de cerca de $500.000
We
millones de
have a
pesos,
remnant of
unos
maybe
120, 125
$500,000,
millones de
maybe
dólares en
$125
cifras
million in
dólares. Y por
figures.
supuesto también lo que
And
hemos pagado ya
obviously, what we have also paid
en los partos de mujeres,
in
en muchas ocasiones, pues
labor for
en todas
gestating women,
partes, donde usted
often
llega, yo fui
everywhere.
alcalde de Ibagué
I
y pues
was a mayor for
atendíamos a
Ibagué.
todas las migrantes en
We
la
tended to
mejor
all the
forma,
migrant
atendidos muy bien y
very
por
well.
supuesto la
We
mayoría de
tended to
los
them well. Obviously,
nacimientos
most
eran
births
de mujeres venezolanas. O sea
were
que están
from
aportando
Venezuelan
a
women.
una
So
natalidad que
they're
va en
contributing
descenso
on
en este país.
natality that is
Este año creo
decreasing
que
this
no serán
country.
sino
This year,
450.000
I think it's
nacimientos,
only going to
lo que
be
implica necesariamente que para
450,000
el
births. This
2050
implies
a
that
ese
for
ritmo Colombia
2050,
no
at that
tendrá
rhythm, Colombia is not going
un
to have
aumento en población, sino una
increase in
disminución que se
population,
calcula
but
a
a
través de
decrease. And
52
we
millones
calculate
que
that
ya
instead of
calculamos,
52
podría
million that
estar
we
para el
calculate,
2050
we could have for
en
2050
47 millones.
in
Vea usted la
47
importancia
million. You can see
de
the
una migración, en este
significance
caso de
there
personas
of
jóvenes, para
migration
un
of
país como
young
este
people
que
for a
si no
country
hubiera sido por la
such as
migración
ours.
estaríamos
Had it
todavía
not
por,
been for
por debajo de
migration,
los 50
we would
millones
still
de
be
habitantes.
under 50
Entonces ahí
million
también
inhabitants.
hay algo algo que
So there
es
too, we have something
importante
which is
para ganar
important
y la
to do,
asignación de
and
recursos
the
recientes
allotment of
para poder
resources
pagar esas
be able to
emergencias y
pay
esas atenciones.
those
Fuera de otras
emergencies.
ayudas que son en planes de
Aside from
desempeño
other
para
things,
hospitales que están, por ejemplo, como el hospital
hospitals
de
there,
Urabá,
for example, the
¿cierto?
hospital in
De
Urabá,
Turbo, especialmente
or
el de
the
Urabá
hospital in
antioqueño, Turbo
in
y
the
Necoclí,
Ethiopia,
donde son los sitios
Urabá, and
en donde
Necoclí,
llegan más
the
de
places
300.000
where we get
personas
more
que
than
recorren el Darién y
300,000
que
people
llegan
that have
a
gone
la
through the
prestación de
Darien
servicios y que los atendemos en esos
provide
hospitales.
services when we
De esa
come to the
manera, entonces, aquí llevamos
in
cuáles
this
son
way
las
we have
respuestas que nosotros
the
tenemos que dar
responses that we have to provide
para esta situación de
for this
migrantes en
situation of
Colombia.
migrants
Primero,
in
la
Colombia.
formulación de un plan.
First of
En este
all, to
momento está
draft a plan. At this
para
moment, we
el
have it
concepto de la opinión pública,
for
como
the
todo, que tiene que
concept
haber un
of public
concepto previo.
opinion. It
Todo
has to
se
be a
somete aquí
fair
primero a una
concept. First,
revisión
we present here
cuando
everything
van a
to our
salir
review,
esos planes.
and we are going
Y
to have
la
these
comunidad en
plans,
general tiene
and
posibilidad
the community in
de
general has the
informarnos
possibility
sobre
of
qué
informing
entienden
us in
sobre
respect
la
to what
posibilidad de
they
un plan de atención
understand
en el
in
sector de
the
la población
possibility of
migrante,
attention on
refugiada,
migrant population,
retornada,
refugee
porque hay
population,
muchos
returning
colombianos que
population,
retornan también
because
al
there's a
país,
lot of
no
Colombians that are
mucho como
returning to their
quisiéramos,
country,
y
not as
comunidades
many as
que
we would
acogen
want.
tanto
And there
a
are communities
refugiados,
that
tanto a
receive
migrantes
not
o
just the
como a los que
refugees
retornan.
and
Entonces,
migrants, or the
este es un plan
returning
decenal
population.
de,
So
de
this
salud
is
pública
a
que en
plan
este momento
for
se está
public
trabajando.
health that
Las
we're
otras
working
tienen que
on
ver con
today.
la atención de la población
Others have to
migrante
do with
y
servicing
refugiada
the
en un tema
migrant
que a veces es
population, collected
desapercibido,
in the
que
topic that
tiene que ver
sometimes
muy especialmente con la
opportunity that's
atención
very
psicosocial
specifically
para la población
it's
migrante
psychosocial
y, por
attention for the
supuesto,
migrant
para eso en
population, and
este momento
obviously
dentro de lo que
to that
es
end
la
within
atención primaria, y
what
por
we
eso
have the primary attention, and
quiero
that is why I would like
agradecer que de
to
los 5 puntos estemos hablando de
that
atención
of the
primaria.
5 points that we're
En este
speaking about
momento este
primary
gobierno
attention.
está tratando
At this moment, the
de
government
adelantar
is
una reforma
attempting
que
to
se
bring
basa
forward a
fundamentalmente en la
reform
prevención y
based
promoción de
mostly
atención primaria.
in prevention,
Pero no nos
promotion, and
quedamos
primary
esperando en eso.
care.
Hay una ley que es la
I'm not going to
1438
remain here. We
del
have the
2011,
1438
que es todo un
of
compendio sobre atención
2011,
primaria.
which is an entire
No es más
compendium
que
of
volver a
primary
Alma
care.
Ata.
We just
Es
have to
decir,
go to the Alma
Alma
Ata,
Ata
doctors, and to
1978,
the
donde
Alba
los
in
postulados claros de
1978,
atención primaria
where
se
the clear
convierten hoy más que
postulates,
nunca en una
candidates,
necesidad importante
serves
para este
a
país. Y por
significant
esa
need
sencilla
for the
razón
country.
es que
And
estamos
because of
trabajando
this
porque
reason is that we're working,
así es. Como la
because
1438 del
for
2011,
example,
hace
the
13
case
años,
of
se puedan poner en
1438,
práctica.
only
Hoy
13 years
tenemos
ago we can
10.000
put it in
equipos
practice. Today we have
integrados
10,000
por profesionales,
integrated
cada uno de
teams
8
of
personas,
professionals,
médicos,
each one
enfermeras jefes,
composed
enfermeras auxiliares,
of doctors,
odontólogos,
nurses,
psicólogos,
auxiliary
porque
doctors,
tenemos que la
doctors,
atención.
psychologists,
Y por
because we
eso
have to
entonces hay en campo
attention.
hoy más
And
de
therefore,
9.000
out in the field,
psicólogos
we have more than
atendiendo todos esos
9,000
sectores vulnerables,
psychologists
y tienen
tending
la
to all these
responsabilidad fundamental
vulnerable
de
sectors, and they
entrar
have
en
the
contacto
fundamental
con migrantes y
responsibility of
con
entering
personas
in contact
vulnerables,
with
como son
migrants
nuestros
and with
migrantes, para iniciar un
vulnerable
trabajo
populations, such
que
as
se
our
va
migrants, to begin to work
a
that
llevar
is
a
going
cabo
to be
con un
forward
crédito de 150
with a
millones de
credit
dólares
of
que en este momento
$150
está
million,
ya para entrar a
and this
COMPES y
movement
CONFIS,
is
con el
going to
fin
be
de que podamos
in
montar
countries
todo un
so that we
programa
can
de
begin
atención
on
de salud mental en el país, que al mismo tiempo pueda atender las situaciones y necesidades de nuestros migrantes. Además, están aquí los equipos básicos que, como les decía, cuentan hoy con más de 9.000 psicólogos que están en campo atendiendo esas necesidades y garantizando la atención inicial. Aquí logramos en primera instancia ponernos en contacto con el migrante que no sabe sus derechos, con el migrante para afiliarlo al sistema de salud, al migrante para entonces vacunarlo, por ejemplo, al migrante para hacer una revisión. De acuerdo a los estudios recientes, podemos determinar que la incidencia de VIH en nuestros migrantes es el doble de la que tiene Colombia. Nosotros tenemos aproximadamente, y creemos que deben de haber unos 200.000 personas VIH positivas, de las cuales hemos identificado y diagnosticado 145.000. Se hace necesario entonces, y para eso hemos entonces ahora, y estamos importando a través de la OPS, estamos importando
Organization
1 millón de tratamientos de
importing 1
fotoagravos,
million
porque en el
treatments.
mercado estaba en
This is
410
the
mil
revenue
pesos
about
y
400.
nosotros lo podemos traer a través de la OPS en
Biggest
11.000 pesos.
organization
Implica
in the
necesariamente
United
que
States.
con un solo tratamiento que estaba costoso en Colombia, ahora podemos dar gratuitamente un tratamiento a 40 personas. 1 millón de tratamientos. Esperamos cubrir a migrantes y a todos los colombianos para protegernos del VIH. Recordemos que hoy paciente bien tratado, paciente que no contagia y paciente que puede vivir una vida común y corriente de acuerdo a lo que vive cualquier ciudadano colombiano. Hoy con las expectativas de 74, 75 años para los hombres y de 80 para las 88 para las mujeres. ¿No es cierto? Benditas ellas que no pueden estar más en este mundo. Entonces,
Hopefully they
esta
can
es,
remain more
es
far
el
in this
futuro.
world. So
Para
we have
mejorar
this
entonces
situation.
cómo, nosotros tenemos que también,
We also have
logrando
to
detectar, estar
achieve
trabajando
and
en
be able to
atención
detect
primaria para
with the
prevenir.
primary care to
Hemos
be able
vacunado
to
hoy
we
un
have
número muy
vaccinated
importante,
today
casi
a very
de más de
significant
700
number,
mil
more than
personas,
700,000
entre niños, la gran
people
mayoría de
amongst
ellos, haciendo
children,
un
most
esquema.
of them,
También la
and
posibilidad de los adultos y de los adultos
possibility of
mayores,
public
menor
health
número.
and the
Importante
elderly.
porque el esquema de vacunación en
Some of them
Venezuela
because
se ha
the
deteriorado.
time for
Implica
vaccination in
necesariamente
Venezuela
que
has been
casos como por
deteriorated.
ejemplo de
It's very
sarampión,
dangerous.
que
This is
somos
for
libres de
example of
sarampión,
measles.
se nos
We
pueden
are
presentar en
people
Colombia
free.
y por eso
We
se hace
can now have
necesario.
them in
Y
Colombia,
por
and
eso hablaba el
necessary that
doctor Ciro muy
we
claramente
see
en uno de
information
sus temas, no
in
solamente
one
del
of the
acceso que lo
topics,
estamos
not just
mostrando
of
ahora,
access
como a
that
través
we're
de los
showing us here, but
adultos
also through the
ayudamos al
access
migrante, lo
that
accedemos a los
to the
servicios,
migrant, we
sino a
tended
que
to the
hacemos una
services.
vigilancia de
Also,
salud.
we have a
¿Cómo
vigilance in health.
prevenimos que en Colombia enfermedades que ya no están, enfermedades que ya logramos nosotros ser
Present
libres de esas
is
enfermedades,
that we
no
all
vuelvan a
want
aparecer en
to
los
make
territorios?
ourselves free
Entonces
and
cumplimos
now
que son fundamentalmente los preceptos
they
de
are
los, de
basically
los ministros de
the
América que se
ministries
reunieron en el
of
2018 como nos
America
indicaba
that
el
got
doctor.
together in
Y
2018.
podemos entonces ir
As
complementando
was mentioned, I
la
think we
posibilidad de que
complement
entonces
the
no estamos solos
possibility
trabajando
that
de
we're
la
not
mano de
alone
todas las
working
organizaciones que hoy
together with
están aquí,
organizations that are
partiendo
currently
de la
present,
Organización Mundial de la Salud, de la
beginning
Organización
with the
Panamericana,
American
de
Health
la OIM, de
Organization,
la ACNUR,
of the
etcétera,
OIM, of
y podemos entonces seguir los
etc.
y las decisiones del proceso de Quito para entonces
Make the
lograr
decisions
una
of
mayor
the Quito process to achieve a greater comfort for
Eso
you.
implica necesariamente
This
el
would
trabajo
imply
que tenemos que continuar
necessarily
y
the
hacer.
work that we have to continue.
No sé, no pasa. Ahí creo que terminamos. No, esta es una cosa que ya les había dicho.
We can see
Tiene que
something
ver
that
con
I
la
already
cuestión.
mentioned. It has to do
Nosotros atendemos migrantes
with
en
something
partes.
significant.
No
We
hay
tend
ninguna,
to migrants
no
in
recibe
the
la atención.
labor.
Pero
There's
no nos hemos quedado
is
ahí.
not going to
Tenemos que
receive
ir a que
a
cada una de
service,
ellas
but we have to go
pueda
beyond.
recurrir
One of them
con nuestros equipos básicos y detectando
can
todos
go
estos
to their
sitios
basic
en donde
teams
pueden
and
estar los
detect in
migrantes.
sites where
Estamos nosotros
migrants might
entonces
be. That's
logrando
where we are
comenzar
then
un control
being able
de
to
estas gestantes,
begin a
por lo
control of the
menos 6
women's
controles
gestation,
antes del parto
at least
y poder
6
atenderlos
controls
de la
before
manera que se
labor,
merece,
and to be
porque
able
esos
to
son
send
nuestros
them
retos.
as
Ninguna
they
se queda
deserve. These are our
sin la
challenges.
posibilidad
To leave no one
de que
behind
tengan la
without the
atención.
possibility of
Los otros
having
retos tienen que ver
primary
con el
care.
diálogo
Those
y
challenges have
la
to do
cooperación
with dialogue and
interestatal con los
cooperation
países
between
fronterizos.
states.
Nosotros
With
no
all
podemos entonces
countries.
porque
We know
Trump pone un muro
just because
en el río
Trump is
Bravo,
going to
¿no es
place
cierto?
a
Y
wall
entonces
on their
Panamá cerca
Bravo,
los
then
caminos por donde
Panama
tienen que,
is
por
going
donde
to
están los
close up its
migrantes.
path
Y entonces
for
nosotros, ¿qué
migrants
vamos a
to
hacer?
cross through. So what are we
No,
going to
nosotros
do?
tenemos que tener otra
No,
posición,
we
la
need
que
to have
mencionó el
another
presidente en la
position,
OPS,
which is the one that
¿no
the
es cierto?
president is
Muy
putting
parecida
forward.
a la que el Estado
Very
soberano de
much
Santander
related to the sovereign
en
state
el
of
siglo pasado,
Santander
en
in the previous.
1865 en su
Actually,
constitución,
in
dijo una cosa
1865, in this
supremamente clara.
constitution,
El
said
que
something
pisa
very
suelo
clearly.
santanderiano de
Whoever
Santander,
stands in
el que pise
Santander
suelo de
floor,
Colombia, debe
whoever
recibir la
stands
generosidad,
in
debe
Colombian
recibir la posibilidad de que se
territory
sienta que
has
aquí hay
to
un país
receive the
que
possibility
tiene y es generoso porque
Considerate
respeta los derechos
generous,
humanos
that
y sabe que la
human
persona que
rights,
llega aquí
and that knows
necesita
that
apoyo,
that
colaboración,
you need
que no
support,
vienen por necesidad,
collaboration, because
no
they
vienen,
are
no
on
vienen
a
solo porque
need.
se
They
tienen
have
porque o se están
only because
refugiando
you need,
o porque
or
están
because
bregando a
they are
tener una
ready
posibilidad
to
más próspera en su vida. Y nosotros tenemos que hacerlo, porque nosotros hemos estado
we
allá,
have to do.
hemos
Because we
y hemos
have
sabido
been
cómo
there.
nos tratan en otros
And
sitios.
we have
Aquí van y
all
dicen,
the
no,
big
aquí
cities
estamos
and other places.
en
They say,
Estados
well,
Unidos muy bien,
we
sí,
were in the United
lavándole
States
los
quite well,
inodoros
and we're
a los
toilets
norteamericanos, ¿no es cierto?
for the
O
North
siendo
Americans,
maltratados en
right?
muchas partes.
They
A nosotros se nos olvida que apenas presenta uno
get
el
the
pasaporte de
food
Colombia,
as the
enseguida le dicen a
percent
uno
Colombian
si
passport.
uno es coca, si uno tiene
Immediately
que ver
they
con la
ask
coca.
us about
Y a las mujeres
cocaine.
tratándolas de
And
prostitutas.
women, they
Ahí
are
no puede,
them
eso
as
no puede ser
prostitutes.
la
And this
presentación que
cannot
nosotros vamos a
continue
tener.
being so, the
Entonces,
presentation
si
that we have.
si hemos recibido ese rechazo,
If we
yo lo tuve una vez en Noruega,
I
donde he vivido
felt that in Norway,
que íbamos en un carro diplomático.
we were in a
Todo el mundo
diplomatic
lo dejaron
car,
pasar, solamente a nosotros.
and they
Nos
let
metieron en un
everyone
sitio que
go
yo
by
considero
except
que era de
us,
rayos
and they
X, y ahí nos
placed
estuvieron
us in a place
con
which
tres
was
niños, con dos
X-rays
niños pequeños
with
y
two
una
small
familia.
children and an entire
Eso
family.
es. Todo el mundo pasó, excepción de nosotros,
Everybody
porque éramos
went
europeos.
through except us
Esas
because we're
situaciones
American.
nosotros tenemos que
And that
entenderlas para
situation,
entender
we have
entonces
to
que
understand
cuando
this
llega
so as
alguien
to
aquí
then
nosotros debemos
understand
de ser
when
generosos,
someone comes here, we
ser
have
seres
to be
humanos,
generous.
entender que esta es una necesidad
Human
de
beings
muchas y
to
otras personas.
understand that this
Entonces yo me siento muy
for their
comprometido de
lives.
poder estar aquí
So I
con
feel
ustedes,
very much
porque
committed to be able to be
estos
here.
5 días son
That
supremamente
this
importantes.
5 days are
Primero, para
extremely
mostrar qué estamos
important.
haciendo.
First of all, to
Segundo,
show
para corregir los
and
errores que
secondly,
hayamos
to correct
cometido.
mistakes
Tercero, para
that
poder
we
aprender
have committed,
de
and
otros
thirdly, to be
países y
able to
poder
learn
entonces
from other
mejorar
countries and
sustancialmente
to then be
y
able
lograr,
to
cumplir con
improve
esos preceptos que hoy nos
and to
trajo
comply
el
with the
doctor,
systems that
el
were
doctor
brought
Severino
by
de
Dr.
atención
Severino
primaria, de qué vamos a hacer
primary
con las
care
enfermedades
of what we're
crónicas que
going to
cada
do
día
with chronic
cuestan
disease
más para el
that
país,
every day
cómo
are more
vamos a
expensive
financiar
for
los
the
sistemas de
treatment.
salud,
How are we
cómo
going
vamos
to
a hacer
finance the
una
healthcare
investigación
systems? How are
adecuada
we going to
con
have
muy
adequate
fuerte evidencia
with
y cómo vamos a
strong
atender las
evidence on how
emergencias
we're going to
y
tend
y
to
a
the
lo largo
emergencies
plazo, cómo lo vamos
and
a
on the
afrontar.
long term,
Y como lo
how
dijo el
we're
doctor
going
Ciro
to
Cárdenas,
make it sustainable
mejorar el
as
acceso
Ciro
de
stated,
todos y cada
to
uno, no
improve
solamente a los
access of
migrantes,
each of us,
sino
not
al mismo
just of
pueblo
migrants,
colombiano,
but
la
also of the
vigilancia de la
Colombian
salud. Hoy
people.
tenemos y estamos
Healthcare
trabajando con la
tickets that
Organización
today we
Panamericana
have,
de la
and we're
Salud en
working
un
with the Pan
brote
American Health
de
Organization. We had an
fiebre amarilla
outbreak
en
of
donde
yellow
no lo
fever,
teníamos.
where
Y
we
en todo
did
el
not
centro,
have
muy
it
cerca de
previously,
aquí,
right smack in the
doctor
middle
Severino, muy cerca de acá, un
of
brote
the city,
muy
very
fuerte.
close
¿Por
here.
qué?
We had
Porque
a
resulta que hay una
why?
gran
Because it
reserva
turns out
forestal,
that there's a great
20.000 hectáreas en el oriente del departamento del Tolima, muy cerca de aquí, a 120 kilómetros de acá,
just
más o menos.
120 kilometers away.
Pero nos introdujimos en la
But
naturaleza,
we went
estamos
into nature.
rompiendo con la naturaleza. Nosotros
Complete
no estamos
nature.
respetando la
We are
naturaleza.
not
Y entonces, esa que era una reserva controlada por
And
la
that
selva,
was a
hoy es una
control
reserva que donde se está
today
peleando
is a
con los animales
reserve
y los
where
primates
humans are coming in.
que circundan por toda esta
And
región
the
y se
primates
van
that
hasta las selvas y
live in that region that go all the way
en ese
into the
trayecto,
mountains.
pues
In that
son
trajectory.
los vectores y han traído entonces no solamente el primate,
And
no
they brought
solamente la
not
Aedes,
just the primates and
sino la
the
posibilidad
Aedes,
de que hayan muerto.
but the possibility
Y
of
por eso
death.
estamos en este momento trabajando
And
desde hace
that's
4
why
semanas
at this moment we're
intensivamente para
working
el control
intensely
de ese brote que se
to
presentó,
control
que
that
nunca antes se ha
outbreak.
presentado. Aquí no hay
Where
gentes como Trump que no creen en el cambio climático. Aquí
for example, people like Trump that do
está
not
promulgando todas las posibilidades del cambio climático. Y nosotros tenemos que
all the
luchar
possibilities
para
of
que esa
we have
situación
to
no se presente.
so that
Esas
this
son las,
situation
eso
not
van a
come
ser
about.
las
These
pandemias que nos van a
are going
llegar.
to be the
Para eso
pandemic.
tenemos que estar preparados.
That's
Y
why
por
we need
eso
to
si hay un
prepare
pueblo que
that.
llegue aquí,
That's
tenemos
why
que
if
atenderlo
there's
de
a
forma
people that
inmediata,
arrive here, we
vacunarlo,
have to
atenderlo, revisarlo sus
tend
enfermedades,
to it
para poder
immediately.
tener
We
la
have to
seguridad
review
que
its
todos nosotros
diseases to
hemos
be able to
soñado.
have the security
Ese es
that
un
we're
factor
all
súper
taught. This is that it's
Entonces,
extremely
vean
important
ustedes el
you
por
can
qué
say
la necesidad
why
de
we have
reducir
need
entonces
of reducing the
las dificultades a través del trabajo,
difficulties
como lo ha
work
planteado aquí muy claramente todos
as
ustedes,
proposed
y
by
cómo
clearly
podemos
by all of
no
you
dejar a nadie atrás.
on
El
how
trabajo tiene que ser
work
eso,
together so that no one
no
is left
dejar a
behind.
nadie
We have
atrás.
have to do that,
Ni
not
siquiera.
leave anyone behind.
Ustedes ven un desfile de lobos,
When you
el
see a
alfa está
parade
impidiendo que
boat,
nadie
the
se quede
alpha
atrás,
male is
ni
always in the
refugiados,
back,
ni siquiera
making
los
sure
que
that
están
no
heridos
one's
aquí.
left behind.
Tenemos que
Not even
aprender
those that
todos
are
a
wounded. We have to learn from the
que
wolf
defienden y protegen a toda
that
su
defend
comunidad,
and protect
a
their
todo
entire
todo su
community,
grupo. Y yo creo
to
que
their
nosotros todos
entire
somos seres humanos
pack.
viviendo en
I
este
believe that
planeta.
we are
Y
all
si no
humans that
trabajamos
live
de la
in this
mano
planet, and if we do not
y
work
seguimos
together
destruyendo este planeta,
and we
no va a
continue
haber
destroying
raza
the
humana,
planet,
no van a haber
there's
humanos.
not going to
El
be
sur llegando a migrar al norte, el
the
norte
south
cerrándole sus
trying
fronteras.
to migrate
Nosotros
to the
tenemos que
north, the
cooperar
north closing
para que
down our
nadie del sur tenga que ir al
operates so
norte.
that no end
Si
is
logramos
completely
desarrollar
go
este
to the
país,
north.
si
And we can
eliminamos la
develop this
guerra,
country
si
if we
eliminamos
eliminate our
la pobreza y
if
logramos
we
que cada uno en su sitio pueda tener
we're able to have everyone
el bienestar que se merece
have
y
the
no lo que
money
estamos
that
viviendo
they
hoy. Ya
deserve
apareció
and
una
not
nueva
what
guerra.
we're living
Entonces
today.
se reactivó.
Now we have a
ADEPO,
new war.
ADEPO, ahí tenemos.
Adepo, it was
Siria,
reactivated because it already
Siria,
existed.
son
Syria,
del mismo territorio.
they are
Ucrania,
from the same
Palestina
territory, Ukrainian,
y
Palestine,
cuántas más. Y la pobreza poluyendo por todas partes
and
del
the
mundo. Entonces,
poverty
yo
all
sí
over.
creo que este es
So
una escuela
activity
hoy.
is a
Doctor
school
Severino,
today.
mil gracias.
Severino,
Doctor
thank you
Fon,
so
gracias.
very much.
Doctora
Dr. Tito, thank you. Dr.
Gina, que
Tina,
siempre nos acuerda, y a todas y todos ustedes que
always
están aquí.
with us, and to all
Yo
of you
creo
that are
que si
present.
nosotros no somos capaces
I
de
believe that
poner
if we are not
la
able
atención a estos
to
problemas,
provide
tampoco seremos
service to these
capaces de
issues,
atender todos los demás
will
problemas que se
not
nos van
be
a
able
presentar en el
to
futuro.
tend
Muchas
to
gracias a
all
todas y
the
a
other
todos.
issues
Muy
that we
agradecido.
have. So thank you to all of you. Thank you very much.
Gracias, Ministro. Thank you, Minister, for your message. So, Dr. Santino, are you leaving me?
Gracias,
Okay.
ministro, por su salud.
Okay, thank you very much.
Bien, muchas
Thank you again, Minister, for your message. We want to apologize for the people who are attending online from Spanish-speaking countries because we are having some problems with the audio. We are trying to solve it as soon as we can. Meanwhile, I'm going to speak in both languages. And also we invite you, if you understand English, to switch to English channel. Well, let me check the agenda.
Permítame verificar la
Um,
agenda.
Now it's the moment to start
Ahora es el momento de comenzar.
knowing cases from countries. The
A ver,
first
casos de los
case we are
países. El
going
primer
to
caso
know
que
is
vamos
from
a ver
Brazil, because
Brasil.
Brazil
Porque
has
Brasil
innovated very well,
ha
including migrants and
mucho
refugees to its primary
incluyendo a
healthcare
los
system,
migrantes y a los
even
refugiados
with the
a
difficulties
sustituir
of
sistemas de
barriers,
salud
like
primaria,
barriers
con las
of language
dificultades
or
como barreras de idioma,
certain economic disparities.
ciertas
So
dificultades
we are gonna
económicas. Así que
see this
vamos
case,
a ver
and
este
let
caso.
me say it in Spanish too. Vamos a ver el video de Brasil, que es un país que ha sido muy innovador en
We're going to see
incluir a
the
los
video from
migrantes
Brazil, which has
en
been
su
very
sistema
inclusive to
primario de
migrants
salud, a
in
pesar
their
de las
primary health care,
dificultades o
because of the
diferencias de lenguaje
difficulties,
y de otros
language difficulties,
desafíos
and
que
of
tengan en
other
términos
challenges that we've had
económicos
in
o
terms
socioeconómicos.
of
Before we
socioeconomic
watch the
aspects.
video, I want to let you know that all these videos that we are going to share during the school have been created exclusively and specifically for the school. And it is important because we have the privilege to know those practices from first hand and to start thinking how to adapt the successful practices to our own realities. Estos videos que han sido creados para la escuela han sido hechos
These videos that have
exclusivamente
been
para la
created for
escuela
the
y
school
esto
have been
realmente es un privilegio que nos
for the
permite
schools, and
conocer
it's a
de
privilege that
primera
allows us to
mano
get to know
cómo
firsthand
estos países han
how these
enfrentado las
countries
situaciones
have faced
desafiantes y
challenging
entonces nos permite
situations,
pensar cómo
and this
adaptar
allows
las
us
buenas
to think
prácticas de
about
estos
how to
países a nuestras
adapt the
propias
proper
realidades.
practices
Let's watch
of these
the video.
countries to our own reality. Veamos el video. Let's watch the video. No Brasil, os migrantes estão cobertos pelos turistas, os que têm um nível de saúde sabem até chegar. Essas no final, era município de Minas localizado no estado da Refugee na fronteira com a Venezuela. Venezuela tem mais de 1,1 milhão de venezuelanos tentando no Brasil. Receberam autorização de residência e 134.000 foram reconhecidos como refugiados. Esse trabalho ocorre por meio da Operação Acolhida, que é uma resposta organizada do governo brasileiro em parceria com agências especializadas das Nações Unidas e parceiros da sociedade civil organizada. A OPAS, a Organização Pan-Americana da Saúde, integra esse esforço, contribuindo e apoiando as autoridades envolvidas. Para garantir alimentação, segurança e saúde. Esses abrigos contam com espaços
I want to congratulate the video team. Yeah, an applause for them.
because they put together all these elements that let us know how, even with the difficulties, the goals can be reached. So thank you to the video team. And well, with what we see from Brazil's case, it is settled the stage for our main speaker of today, that is going to go in depth with some of the challenges that we see from Brazil's cases. So let me welcome in Professor Carl Blanchet, who brings extensive expertise from his work at the University of Geneva, where he is director of Geneva Center of Humanitarian Studies, and he has a role as co-chair of the Lancet Migration Initiative. He will be guiding us through the complexities of primary health care for migrants and refugees, showing how it plays a vital role in achieving universal health coverage and addressing the unique challenges faced by displaced populations. Professor Blanchet, the floor is yours. Let's wait some seconds to have the video of Professor Blanchet ready for us.
Hello, my name is Carl Blanchet. I'm a professor in public health at the Faculty of Medicine at University of Geneva. And I'm also the director of the Geneva Center of Humanitarian Studies. And as such, I'm the co-chair of the Lancet Migration European Hub. It's a pleasure for me to do this session on migration and primary health care. So why do we talk about primary health care? So I would like to go back to the WHO definition, where primary health care is defined as an approach where you have a multi-sectoral action, interventions that are coordinated at all levels of the primary healthcare levels, and where primary healthcare services are here to achieve equity and health outcomes at the individual, household, and community level. And it's very much based on the approach of a health for all, or the health in all policies. The idea is very much to have all the actors of the health system, to have a national and collective effort to improve the health and the well-being of the populations. And here we're talking about a wide range of services, from preventative care to curative care, but as well to early detection and control of communicable and NCDs, but as well to try to prevent or to mitigate all the risk related to health, to have better health outcomes. I would like to go back to the universal health coverage cube with the 3 dimensions. The 3 dimensions are very much about who is going to benefit from health services, who is going to pay for that as a second dimension, and what kind of services are they going to get access to. And in a way, it's very much about what kind of decisions can we make to make sure that as much as possible, every group of population, every group in the population is going to get access to a comprehensive package of services, and trying to mitigate or to reduce their financial risk when they get access to services. It is very important when we talk about migration and health. One of the key issues that we have is how to make sure that actually migrants, either refugees, asylum seekers, economic migrants, undocumented migrants, have access to services at no cost or at reduced cost. And that's a key issue and a key challenge for many, many health systems. But first of all, when we talk about migrants, we are in front of a very, how do you say that, non-homogeneous group of people. They vary by their status. Are they refugees? Are they asylum seekers? undocumented migrants? Are they economic migrants? Are they simply tourists or students who go from one country to another? Where do they come from and where do they live? Do they live or do they come from urban or rural areas? Where are they going to? Do they go to cities or are they going to rural areas? And are they only here in transit in order to go somewhere else? Their temporality, are they here for a long time? For how long have they been living in the country, in the host country? In which conditions do they live? And for how long? What is their plan? And of course, their socioeconomic status. And we know that social democratic status is a key social determinant of health. Their age, their gender, are they here as a member of the family? Are they the breadwinner? Are they the head of the family? What is their education level? What are their professional skills? Can they get access to jobs? And also their motivation. You have a wide range of expectations or motivations amongst migrants. Some are motivated by getting access to education, other by jobs or safety, fleeing violence in their country or an armed conflict. We have a lot of evidence on the common health risk among displaced populations. And then we start with one of the key one that is usually undocumented or under-researched, mental health disorders. We have a lot of evidence that migrants have suffered from trauma from that they have experienced events in their country, violence, conflict, or floods or earthquakes, but as well trauma they have experienced during their migration journey, crossing borders, and we have a lot of evidence that a lot of people actually experience violence through the police or border control authorities. The second one are very much about chronic conditions, NCDs, non-communicable diseases. We have a lot of evidence that people come from countries, suffer a lot from chronic conditions, diabetes, hypertension, just to cite a few, and that it is a key challenge for healthcare providers to ensure continuity of care and continuum of care, making sure that they get access to the same treatment during their journey. It's a key challenge. And of course, injuries and trauma. And it made me think about the beast, this train crossing Mexico and going to the border of the US, where people jump on the train and suffer from injuries when they jump. They suffer injuries because they are victims of violence and so on. And of course, infectious diseases. Their living conditions are a key determinant of their the risk they have to contract infectious diseases. We want to make a case that migration is a key social determinant of health. That's important. And to do so, for healthcare professionals and for policymakers and for researchers, it is important to better understand the different phases of migration and the different risk factors, but as well different health conditions people have at these different phases of migration before they leave the pre-migration phase, during the journey, during the movement, the displacement, but as well when they arrive in a host country, either in transit or simply to find the right condition of and well-being for themselves and from their family. We have now a good understanding of the living conditions and the risk factors experienced by migrants at all the different phases. And I put here on the screen one of the key papers we published exactly on that, looking at the mental health conditions of refugees in Greece, and because of what they have experienced in their country and during their journey, but as well trying to understand as well why mental health issues are key for migrants and refugees, including in Europe. but as well the living conditions. So we're trying to challenge all the misinformation and preconceived ideas that people have, or media may have, or political parties may use in order to have a negative narrative about migrants. And of course, now we know the living conditions where they arrive in hotspots, for example, that are surrounded by the police or by walls, but as well the living conditions they have on the journey in terms of hygiene, in terms of shelter, access to water, and so on, that are key factors that are going to influence the health status of migrants. We are well aware that migration is a very sensitive topic. And here I just put a few headlines in the newspapers, in different countries. And as you can see, there's a narrative that we need to challenge as healthcare professionals, researchers, and policymakers in order to provide some evidence on why these threats or these fears are not funded. And that's important that we also try to train journalists on migration and health. And that's important if we want to achieve this kind of aspect. We're also well aware of all the health system barriers at primary healthcare. And if we want to achieve better equity and better access, it is important to remove all these barriers. And they may be as diverse as making sure that all the messages are well understood in the right language. Here, I'm talking about simply the clinical encounter between a medical doctor and a patient, a migrant patient, and they cannot talk to the same language. They cannot understand each other. But as well, making sure that migrants can navigate the health system where they are, where they live, understanding their rights, understanding the type of services they can get access to, and where these services are. But also, there is a lot of, we have some understanding as well now that actually a lot of services are not accessible because migrants often live in remote places because they can't afford to live in the center of the city, or they live often in peri-urban or semi-urban areas or rural areas far away from primary healthcare centers. And unfortunately, we also have some evidence that migrants suffer from discrimination and racism in their daily life when they take public transport, but unfortunately as well by a few healthcare professionals. And that's important to highlight. When we talk about the challenges from for primary healthcare systems to increase access to services for migrants, there are two different perspectives in my mind. The first one is the health policy perspective, where the policymakers have three key questions. Which package of services are going to be available to migrants? Only emergency services, or do we offer a more comprehensive package where COVID-19 vaccination was actually available to all in Portugal during the COVID-19 pandemic? Or we also have some evidence, for example, in France and in other countries, that only offering emergency services to migrants is going to cost 7 times more to the health system, because actually migrants are going to go and see the doctor with worse conditions than and without any prevention. The second question policymakers ask is, for whom? Who is going to get access to the services? Are we talking about people who are registered, recognized, asylum seekers, economic migrants who are covered by the employers? How about undocumented migrants? How about refugees? What kind of package are they going to get access to? And as well, who is going to pay for that? How to make sure that migrants who just arrive are often deprived from any economic income and job, cannot afford expensive healthcare cost. The second perspective I have in mind are a very different one. It's from a healthcare professional perspective. The question that professionals have is, how are we going to build trust between migrant populations and the health system? How to make sure that they're going to trust me? How to make sure that I'm recognized as a healthcare professional and not as a person working for the police or for the Home Office? How to make sure that migrants are going to get access to the services we provide and they are entitled to? And that's a key challenge. It does require for health system to actually answer the question, where are we going to put the services? In Geneva, for example, the migrant clinic is not at the main hospital, but is very much embedded within different areas, different where people live in communities. The second aspect, the question we have as healthcare professionals, is going to be about continuity of care. How to make sure that actually when the migrant is going to be referred to another level of the primary healthcare system or outside in secondary hospitals, they're going to have access to the same type of services and with the same rights. And the third question is about continuum of care. How to make sure that migrants, and I know migrants are very mobile, they go from one city to another, or they cross borders to go to other countries. How to make sure that actually they're going to be continuum of care and that the next healthcare professionals is going to provide the right treatment. My final message is very much about undocumented migrants. There is today no statistics about undocumented migrants. And on that topic, what I would like to say is that if we achieve to improve access to care to undocumented migrants, our health systems are going to be transformed for everybody. Undocumented migrants, and I'm sure health systems are going to be agile, flexible, and are going to find the right solutions. Finally, I would like to refer you to a Lancet series we have published in the Lancet Regional Health Europe as part of the Lancet Migration European Hub, and we have published a series of 11 papers where we describe all of that, the barriers, but very much about the solutions as well that health system can build and can provide to migrant populations. And finally, a quick word about our initiative here at the University of Geneva and in Europe, and you have the same initiative in Latin America. We are a network of researchers, and we try to work together to make sure that there's more research, more quality research on this topic. We really need to document what is going on health, migration, and equity. Thank you very much.
Thank you to Professor Blanchet for his presentation, putting the accent on the risks that migrants and refugees face. Professor Blanchet bringing us to the importance of tailoring service for migrants and refugees in every step of their journey from their country of origin to their final destination. Before going to South Sudan, I want to apologize again for the technical issues we have had today. We are working hard to solve it, especially with the Spanish channel. And well, this is pretty common when you are kicking off an event. And also we are most of them women and children, and its healthcare system that is already under strain has been able to provide for its own citizens and also for the displaced populations and even they have a conflict and a humanitarian crisis ongoing. So let's watch the video from South Sudan. Let's wait some seconds until this is. I appreciate people from Spanish.
And households, along with an additional 5,200 individuals registered as asylum seekers, which accounts for 3,820 households. This brings the total to nearly 495,000 individuals across approximately 122,000 households in 23 locations throughout the country. The majority of these refugees, around 95% of the total population, are from Sudan. Most refugees in South Sudan are located in Upper Nile State, Unity State, and the Roeng Administrative Area, which make up 87% of the total refugee population. The number of refugees and asylum seekers is expected to increase due to ongoing arrivals through the 16 entry points, mainly at Joda, Wantho. As of 23rd September 2024, over 178,000 refugees and asylum seekers have entered the country. The health situation has worsened due to the impact of conflict on the chronically underfunded health system, rendering it unable to respond to unfolding health crises in the country. In conflict-affected states, 70% of hospitals are no longer operational, while 65% of the population lack access to health services. Between October 2023 and February 2024, approximately 37% of Sudan's population, or about 17.7 million people, have been driven into high level of food insecurity, classified as IPC Phase 3, meaning crisis or worse. This figure also includes 4.9 people in IPC Phase 4, classified as emergency. Primary healthcare services have faced direct attacks on health facilities and staff, looting of facilities, critical shortages of medical imports, barriers to importing equipment and drugs, and fuel shortages that threaten energy availability for hospitals. Health services in refugee camps have not been spared these mounting challenges. Moreover, a large-scale refugee movements to safe areas have placed additional needs on already strained services, exacerbated by disease outbreaks, poor water, sanitation and hygiene conditions, and overcrowding. Inadequate decline funding sector and weak health infrastructure continue to hamper delivery, medical goods, and deployment of staff, resulting in low-quality services. Comprehensive refugee health program has been implemented in South Sudan, including essential primary health care services for refugees in camps and surrounding host communities to address social and environmental factors, improve healthcare access, and raise health awareness through education and campaigns. Efforts are concentrated on disease prevention through vaccination initiatives, sanitation improvements, and surveillance systems. Emergency preparedness measures are in place to effectively respond to public health emergencies. The program emphasizes the management of chronic diseases, early detection and treatment, particularly for conditions such as diabetes and hypertension. Maternal and child health services, including prenatal and neonatal care and immunization, are prioritized to improve health outcomes. To improve service deliveries, UNHCR and health implementing partners in different refugee settlement areas have strengthened healthcare infrastructure, increased workforce capacity, and enhanced governance. This includes procuring education and medical supplies, all aimed at providing high-quality healthcare services, reducing the risk of disease outbreaks. UNHCR supports 17 health facilities in refugee hosting areas and emergency health programs in other locations. Mobile healthcare units are deployed at reception and transit centers to provide essential interventions and prevent disease outbreaks.
South Sudan is one of the newest countries in the world. It's still going through the process of nation building. At the same time, it has quite a chronic humanitarian challenge.
UNHCR is, as you know, responsible to support basic and life-saving services for refugees in the camp setups and also in the urban locations.
South Sudan government, especially Commission for Refugee Affairs, CRA, is providing a protection to 300,000 refugees across the country.
Since the Sudan crisis, South Sudan has also started receiving a number of refugees. We have so far received over 800,000 returnees and refugees who are people affected by the Sudan crisis. And that has meant that we've had to move from being a recipient to being a donor towards hosting and responding to refugee needs.
Our being here as community leaders is to ensure that their health is in place. Most of people are actually suffering from. One of them is malaria, typhoid, measles, let's say diabetes, and other chronic diseases like TB. And in fact, there are people who are also living with HIV. We have primary health care center that is actually providing all those services to us here, but it is not enough. It is being shared by many people, not only as refugees. We also have host communities and people from IDP. The health services that we are actually getting here is not sufficient.
Looking at the population that came from 2,500 to more than 15,000 plus, it has really stretched the limited resources that is available here for the refugees. The mobility those people came with it from Sudan is different from the morbidities that we had here within Gorom. We started seeing cases of insulin-dependent diabetes, have cases of cancer that are registered. We have a number of cases of chronic illnesses that are beyond the level of the primary health care center. Good enough with the support of UNHCR, we are now providing these medications for the chronic non-communicable diseases like the insulin, the antihypertensive medications are provided here. But when this case goes to Juba Teaching Hospital as a case of referral, they don't get the treatment available, especially for the patients who are having cancers. So far, we have a case of non-Hodgkin lymphoma. I have a case of breast cancer. We have a case of cervical cancer, and we don't have a cancer treatment therapy within the country. So when these individuals goes to Juba Teaching Hospital, they just ended up getting another referral abroad. And UNHCR, because of the limited resources, they cannot provide this support for referrals abroad the country. So you'll find those refugees that are here residing within the camp, and they're feeling that the situation is helpless, or they're feeling that they are not seeing any solution for their condition.
We are struggling how we can maintain basic and life-saving service in terms of health.
This facility operates 8 hours a day, which is based on the standard of the PHCC. But looking at this population, we see the need of the facility to be operationalized 24/7.
Our health systems in South Sudan are still under development, and so they cannot take the shock of sudden increases in people with unknown conditions. So by having entry point services, we're able to set up good surveillance and know what kind of issues are entering the country, but also provide very quick medical care to the people as they come in. It has been quite effective to the point that we've not had imported measles cases. Responding to refugee health needs cannot be done by any one institution, any one body. We try to work very, very closely with the Ministry of Health and the government authorities. We have a very strong relationship with UNHCR, with IOM, and with other UN agencies who are actually providing services on the ground. We also have a very good relationship with a number of NGOs on the ground. And so we tend to provide them with funding and then they're able to respond. We also have quite strong relationships with our partners, the donors who are providing funding. Nothing can be done without partnership. So it's important that we map out our comparative advantages and then we are able to then, as a one team, respond to the health needs of the refugees.
Well, as you can see, what South Sudan has done to provide healthcare services for those most in need is impressive. Watching this video, is impossible not to think how to adapt these practices to improve the lives of those migrants and refugees we all work for. So thank you again to the video team to put these stories together. Now it's the time to go to our Q&A session. I'd like to introduce Professor Baltica Cabieses. She is Director of the Migration and Health Research Program at the Universidad del Desarrollo in Chile, who will be moderating this discussion and almost all the discussions during the week. We encourage you all to actively participate by submitting your questions to the platform. And for those who are here, you can just raise your hand if you want to ask a question and someone will give you a mic. Thank you very much. And please welcome her with a round of applause.
Hello, everyone. It's a pleasure and a joy to be with you today. I will be facilitating this Q&A section and the coming ones in the next few days. We will expand this first session for about 10 to 15 minutes due to the time limitations we've had, and we want to give a good opportunity to panelists to share their discussions and reflections upon questions that we have received. I want to say that we have over 500 people connected live throughout the session, and that number is growing, and they're sharing with us a lot of questions and comments. We have over 100 of questions so far, but we will try to group them and synthesize them so that we can have the most discussion and reflections we can, listening to the comments that are live from our online and present people connected. Please remember, everybody, to stay using the online platform to sustain the exchange of thoughts and experiences throughout the 5 days of our global school. I would like to invite Dr. Ciro Ugarte to come to the front if he's here, because he will be responding one question. But as he comes here and he approaches, I will give the floor to Professor Kaufman, who is connected right now with us from the University of Geneva. Professor Blanchett, the question for you from the audience is the following. What role can civic actors, including NGOs, civil society, and others, play in advancing inclusive primary health care to address the health needs and rights of refugees and migrants, particularly in developing and supporting sustainable service delivery? Professor Blanchett, the floor is all yours.
Thank you very much, and thank you very much for having me. I hope the sound is okay. Can you hear me? Can you hear me okay? Hello, hello. Just want to check you
We'll
can hear
give
me.
a second to Professor Blanchett to check connection. I am aware that he's connected from
Yes.
University of Geneva.
Hello, hello.
And to all panelists, please remember to keep
hear me.
your answers concise, hopefully around 1 minute, so that we can take as many questions as we can in the very few minutes we've got left from this first session.
Sure. Okay. I just wanted to check you can hear me. Hello. Sorry.
And Dr. Ciro Ugarte, if he's in the building, please ask him to come front for one question
Hello.
for him.
Can you hear me?
Okay, no worries. We will just wait for Professor Blanchett to connect.
Yeah. They don't hear me apparently. Sorry. Hello, hello.
Dr.
I'm trying to
Ugarte,
talk,
thank you
but
for coming. Please have a seat. in the
There
front.
seems to be a sound issue.
I have one question for you. I'll
Sorry.
give it to you later. We will go to panelists first.
Okay. Hello?
Hello? Hello?
Can you hear me?
Can you hear me? Hear me?
Yes. Yes.
Ah, great. Excellent. So
Excellent.
thank you very
So
much
thank you very
for
much
having
for
me. There's a bit of a echo, but I will be very, very brief. And thank you very much for inviting me. And great to see so many great panelists and great presentations. Civil society organizations are playing a key role in sustaining service delivery. Have seen in many, many countries, in Italy, in Greece, but as well in Jordan, in Lebanon, communities playing a fantastic role in society. Can you hear me now? Yeah, is that okay? Ah, they can't hear me. Can you hear me?
Yes, we can hear you.
Okay, okay, good. So I'm starting, yes, okay, I'm starting again. So civil society organizations are playing a fantastic role in making sure that migrants have access to equitable access to healthcare. And I've seen that in Italy, in Greece, in Jordan, in Lebanon, in many, many other countries, in Pakistan, where actually people in the street, they can be medical doctors, but as well, they can be simply communities offering services to migrants wherever they live and where they are. The second aspect I've seen as well that healthcare professionals in many countries have been incredible as at changing policies. I give an example in France, for example, there was a new law migrants, not very good law, but all the medical doctors and the nurses and the midwives really pushed back and they forced the government to change the policies. So absolutely, civil society organizations are very key in migration and health. I stop here.
A number of questions for you, which I will synthesize as the following question. How has Brazil partnership with UN agencies contributed to strengthening health services and ensuring comprehensive care for migrant populations? Marcus, are you there? Can you hear us?
Yes, I can. I can hear you. You can hear me? Hello?
We can hear you.
Okay. Let me answer in Spanish. Nosotros acá en Brasil tenemos un sistema muy
We
involucrado
in
entre los
Brazil
países
have
de
a
las
system
Naciones
that's very much
Unidas como
involved in the
parceiros
United Nations
interlocutores de
with
las
implementing
autoridades
the
nacionales y
authorities, the national
subnacionales del
authorities, and
país. Los
semi-national of the
esfuerzos que
country.
são
The efforts
empregados
that are
en la
being delivered
assistência humanitária a
in
los migrantes
humanitarian
que
assistance
estão
to migrants
ubicados en la
that are
parte oeste del
located
país
in
são muy
the north part
importantes
of the
y
country are very
buscam
important.
oferecer todos los servicios de
And we
salud
would
a
like
los
to offer
migrantes.
all the healthcare
Después que
services to
salen
migrants
del
after
norte
they
del
leave
país para
from
outros
the north
pontos
of the
de
country to
Brasil,
other points of
nosotros tenemos
Brazil.
un esfuerzo
We have them
coordinado de incluir los migrantes en el servicio público de salud de Brasil, que es un servicio universal y que ofrece
and
todos
they
los
offer
paquetes, los
all the
servicios a las
packages, the
personas que
services
estão
to the
en
people
el
that
territorio de
are
Brasil. Todos los
in
migrantes
all
tienen
Brazilian
acesso a
territories.
todos los
So all
serviços.
migrants
Los
have
problemas
access
que
to
nosotros
all services.
compartimos
The issues
es
that we
de promover
share
un acceso
are
igualitário
promoting
e contínuo a todos os
egalitarian and
migrantes.
continuous
Temos
access to
problemas
all
com as
migrants.
barreiras
They have
e
issues
os acessos a los serviços de saúde em
and
las
access to
capitais,
healthcare
pero
services in the
estamos
capitals, but
involucrados
we
e
are
juntos
involved
trabajando para
and
ampliar
working
o
together
acesso
so
a
as
los
to
migrantes en estos
expand
serviços.
access
E las
to
agencias
migrants and access
del
to
sistema ONU
services.
estão
In the
unidas
own
por la
service
plataforma
agencies, they
R4B,
are
trabajando
joined by
juntos para
R4B,
garantizar o
working
derecho
together to
universal a la
ensure
salud desde acá de
universal
Brasil.
coverage
Over.
from Brazil. Over.
question. I will move on now to Dr. Ciro Ugarte, who has a question as well. I'll do it in English first, okay? So, Dr. Ugarte, what key aspects should countries incorporate into their efforts to address health needs during future migration crises, and how UN agencies are, for example, supporting the process?
Thank you so much. Well, that's a very, very good question because, as you know, the member states and the countries do not have enough resources to cover all the needs of their own population. And having migrants coming into the countries and also the need of healthcare and other health services are crucial. So in that regards, we need to recognize that the protection of the population in the condition of migration is also a measure to protect the communities where they arrive. In that regards, there's a need to do a proper identification and planning, and have also ensure that the health services do provide access to the migrants. This is a process that was agreed by all the ministers of health in the Americas. That includes access to vaccines, access to control, for example, of maternal and child control, but also identifying those diseases that may have the migrants in their origin and are under treatment, both non-communicable diseases, but also TB, HIV, and others that need to be controlled, need to be treated to the migrants. That also includes the information for the health systems. The health systems need to know where are the needs for their own population, but also on the migrants. And moving on those also will allow all the partners, including other nations and other partners, to be aware of those needs, and the participation of the migrants leaderships or the communities or the organizations is crucial in this process.
Fantastic. Thank you so much. I want you all to know, especially those connected online, that we will collect every question from today, and they will inform every other day of the Global School in the Q&A section. So please do continue providing your comments, thoughts, experiences, knowledge, and questions, feeding up the Global School. Thank you so much, especially those who are connected live and continuing to be with us throughout this very first day. I'll go back to you, hostess. Thank you very much.
Thank you, Dr. Cavieses, for moderating this roundtable discussion, and also to the panelists. So we completed the agenda for today. I don't know if Dr. Santino want to come to, and of course, Dr. Gina too, before we say bye to our audience, because you have important messages to share too.
Bueno, yo hablaré en español para variar. Agradecerles el hecho que están acá en la sala y también una apreciación muy grande a los que están
When he also
conectados.
a very specific
Por las
information for
experiencias, las
those that
dificultades que
are
hemos
connected.
tenido, pero
We
tratando
apologize for the difficulties
de
that we
que
have
en
had,
estos
but we are
espacios
trying
virtuales pueda haber una
to
mayor
make
conexión.
sure that in this virtual
Solo
space
tres
we have a better
puntos.
connection. Just
Yo
3
creo que
points to go.
claramente lo hemos
Very
escuchado, lo
clearly, we have heard
hicieron en la apertura y luego con la
was
experiencia de los
discussing the
países.
inauguration and also with the
Brasil,
experience of
Sudán,
the countries
bueno, y el
Brazil,
ministro de Salud
Sudan,
también de
and the
Colombia
Ministry
nos
of
mostró
Health
lo
of
que se está
Colombia that
haciendo.
also
Es
demonstrated
importante esos
in
esfuerzos que hace
how it is
cada país
important the efforts
para
that each
poder
country
dar
does to be
oportunidades
able
a
to
los
give an
migrantes,
opportunity
refugiados,
to
de poder
migrants, refugees,
incorporarlos
and to be able to
en la vida
incorporate
de la
them
comunidad,
in
del
the
municipio, del
community, the
departamento,
municipality,
que
in the
puedan también
department,
aportar a
to
lo
be
que
able
sería
also
el
to
apoyo
contribute
de ese
to this
territorio.
on
Y
this
pues claramente
territory.
también, y una de las preguntas
And
que
quite
hicieron ahora
clearly
Brasil,
also, one of
la
the things that we have
importancia
to
que es
thank
de este
Brazil, the
trabajo
importance of
articulado.
this work.
La unión hace la fuerza, y qué mejor
The
saber
union
quiénes están
makes us
en
strong,
un
together
territorio y cómo podemos unir
to
esas
see how we
capacidades
can join these capabilities
para responder
to
a problemas
answer
muy específicos que
to
trae
very
muchas
specific
veces
issues
un niño migrante, una niña, una
brought
mujer
by a migrant child, a woman, an elderly person. So I believe that we have learned this morning about how important it is to incorporate the migrants, give them opportunities so that they can contribute to the development of the territory of the country and strength which unity makes us strong. You're going to hear the experience of Colombia in respect to the health cluster on the tables, on the territories, and on the border tables too.
Gina, thank you, Claudia, thank you all the
Yeah,
speakers.
thank you, Claudia, for
Tomorrow
today's
is going to
speakers.
move to non-communicable diseases, going to be devoted to continuity of care across border during migration and displacement. We're going to have one wonderful keynote speech from an expert internationally appreciated, and two video, one from Middle East. I'm not going to preempt the content, but this will be on Jordan and Lebanon, and one from a European country, from Italy, where a center for migrants and refugees is being appointed by the government to provide care where the national system is not able to reach out, particularly hard to reach part of the population. So thank you very much. We look forward to fix the technicalities because they were annoying even us, but that's the real life. So bear with us and join us tomorrow. Thank you very much. Thank you, Claudia.
Thank you, Dr. Severoni. Just last thing, which is very important, I told you, please fill the form, scanning that QR code. Please let us have the QR code on the screen, please. And for those who are virtually attending, you also have the QR code, or you have the file. So download it, please, and fill immediately that form to let us know how it was today. I know how it was. Tomorrow, it's gonna be better. We promise. It's not working. It's not working. The QR code. Somebody was able to open the form already. It says this activated. Yeah. We will fix it for tomorrow. Today, all of you have checked on this assignment. Thank you very much for being with us, for your patience with our technical issues, and see you tomorrow, same time. Have a good rest of the day for those who are here. Have a good night for those who are virtually attending in other countries. Thank you. See you tomorrow.